Welcome to Adiveret Kids learning session. Last week we completed the second component of problem behavior, and from today onwards we'll be starting the third component of problem behavior under the social skill development series. And the third component of problem behavior deals with the antisocial behavior or the aggressiveness of the children in the preschool years. These are some of these skills or some of the behavior which will not be taken care between 2 to 6 years of age. Then such behavior will get aggravated and it will lead to a bigger problem in the future of the child. Therefore, the preschool years are so important because fortunately we do have some technique, we do have some mechanism through which we can deal with such kind of problem very effectively. So today we'll be discussing the introductory part of this component of social behavioral issue among the children, and we'll see that what are the 8 micro problems under this antisocial and aggressive issues of the children, which we are going to discuss in details in forthcoming days. It is very critical age, which is 2 years to 6 years of age, and which we often tell as the foundation years of each child's future. If these years are not utilized properly and effectively, in fact, we are making the child's future little bit of ineffective. Why this is so? If we look to some of the research that has already been happened in these early childhood areas, we'll find that the sensitivity of each and every children is bit high in the early years, and once the age progresses, then there is a rigidity or the sensitivity years or sensitiveness of those things get reduced. In other ways, some of the behavioral issue, the sensitivity to change them, to modify them is very high in the early years of the child. And once the child grows and age advances, then there will be a habitual behavior of all those things what the child has been doing between 2 to 6 years of age. So if we measure the ages in the x-axis and the sensitivity or the chances of modifying things in y-axis, then we can see the probability of modification of any behavioral things are very high in the ages of 2 years to 4 years. And beyond that, once the age progresses, then the chances of making change or the chances of making any amendment in the behavioral pattern of the child becomes very difficult. Therefore, these 2 to 6 years age are very important, and that's why we have been talking that if we are not having some mechanism to identify some behavioral issues, then we will not be having any strategies or will not be having any mechanism to resolve them. Therefore, we must understand if there are some behavioral issues in our child. If yes, fortunately we have sufficient time to work on them and make sure those things are taken care quite effectively. So in this segment, we'll be talking about this antisocial behavior of the child or too much aggressiveness among children. And under this major heading, we'll be dealing and discussing with 8 sub-issues, 8 issues in details, so that it will help us to understand things in a better way and therefore it will be easy for us to manage them quite effectively. Now, what are those 8 checkpoints we need to do under this antisocial or aggressiveness of the child? Number 1 is that the child teases or makes fun of other children. So this is one of the checkpoints, one of the symptoms, one of the signs which tells us that there are some amount of antisocial behavior in our child and we need to work on them. Second component or second checkpoint we'll be discussing in details is about the physical aggressiveness of the child, which is given through some kind of symptoms like if the child hits, kicks and pushes other children very often. So those are also under this antisocial or aggressiveness of the child. Third one is about the child seeks to take revenge against others. It could be for anything. If child keeps that in mind, I have to take revenge by any means, then that's a kind of antisocial or aggressive nature of behavior. And if these problems will not be taken care of, then when we are talking about that rigidness of such behaviors in future, where such kind of problem will lead if such kind of things will not taken care in the early years. Fourth checkpoint calls people by names. So it could be, it's not like that name we are talking the given name of the child, but it is some of the name which other child gets irritated, and some of the children who are exhibiting this antisocial behavior, they will just call other children by different names which will make them irritated. So this is another checkpoint. You have to check whether those things are there in the child or not. Then fifth one is about bullies or intimidates other children. So bullying around other children is a big antisocial or aggressive behavioral thing which some of the children they do exhibit in early years of their growth, and they make other children to get irritated and angry. So that is all about intimidates about other to other children. So this is another checkpoint we have to check and do act on them. Next checkpoint is all about destroying things that belong to others. So if a child often tries to destroy things of other children, other colleagues in the school or in the neighborhood, then that also categorized under antisocial or aggressiveness of the behavior. Then seventh one is about telling lies. Telling lies is a kind of behavioral issue that is found in children, sometimes in most of the children, but the amount of lies that is being told by the children or by a particular child, that matters a lot. If a child talks or tells lies very often, then that may be categorized as a big antisocial or aggressiveness of the behavior. So this is something has to be checked very often, and accordingly the strategies or accordingly the action has to be taken in order to make sure that such kind of behavior is not happening very often. And finally, the last checkpoint we need to check under this antisocial or aggressiveness of the child's behavior is about the child bothers and annoys other children. It could be in any form. It could be just tingling them. It could be taking away their things. So the child may do anything which others will get irritated. So these are the 8 checkpoints we need to discuss in details, and accordingly we'll take some appropriate action which will help the child to change the behavioral traits in the preschool years. So based on these 8 checkpoints, after understanding in deep, then we have to give a kind of scoring. So how the scoring will work? If these 8 checkpoints or 8 things are not present in our children, then we'll give a score of 0. For each checkpoint, we'll have to check. We'll see that if such kind of behavior is not present, we'll give a score of 0. And if such behavior is rarely present, or the child is exhibiting such behaviors, these 8 behaviors or 8 checkpoints we discussed, very rarely, then we'll assign a score of 1. If the child is behaving sometimes, or out of this 8 maybe few behavior is very predominant, then we'll just give a score of 2. And all of these 8 behaviors are happening very often, then we'll give a score of 3. So this is the scoring pattern. We'll have to keep it in mind. And these 8 checkpoints what we discussed in our previous slide, we keep it in mind, or we have a template that you may connect with us so that we can provide you this template. So this template can be used at least once in 6 months for doing that check for each and every children in the preschool years. So these 8 points, one by one, we have to check with each and every child and assign a score based on the outcome. Like if it is never, rarely, sometimes, often, for each and every checkpoint, accordingly we'll assign a score from 0 to 3. So once this score is given, then we have to add the total score. Then we'll be getting some of the total score, based on which we'll have to take a decision what is the pattern of behavior of a child. So here what will happen, lesser the score, better is the outcome. That means our objective is to achieve very less amounts of score while we are doing these checkpoints for our children in order to evaluate the antisocial and aggressive behavior of our child. So what about the score? So score, what we need to do is that there will be 2 groups, play group and nursery. They will be one group, and they will be grouped under toddlers, and another group will be comprising of LKG and UKG, junior KG or senior KG, and they will be the KG children, which will be group 2. So for both the groups, the evaluation will be separate, although the checkpoints will be remaining same, but the scoring will be different as far as the interpretation is concerned. Now, once we have these 8 checkpoints done for each children and total score has already been obtained, then we have to add total score. If we get 19 to 24 for the group 1, which is comprising of play group and nursery, then it indicates very significant problem as far as the aggressiveness or antisocial behavior of the child is concerned. Similarly, if for the LKG and UKG, if the score is between 18 to 24, that indicates significant problem as far as the antisocial nature of behavior is concerned. Then if the score is between 15 to 18 for group 1, that is play group and nursery, and 13 to 17 for LKG and UKG, then that indicates a moderate problem for antisocial behavioral issues. And if the score is 4 to 14 for play group and nursery, and 4 to 12 for LKG and UKG, that shows there are some basic or average problem as far as the social antisocial problem or aggressiveness of the child is concerned. And if the score is 3 or less for both of the groups, that means play group, nursery, LKG and UKG, then that shows there is absolutely no problem as far as social issues are concerned. So that's very, very important. We have already discussed why those things are to be uh, done very often for the preschool children. So we must do that to take care of the children. In order to, if it's required, we may modify those things. That's why it's very, very important to get these things done. So based on that, we have to do a regular checkup and make it documented in the child's documentation. So any point of time that can be referred and necessary action can be taken. So based on that, we'll in next session we'll be talking about the very fast issue under this antisocial behavior. So we call that B3 is the component. Fast is the fast checkpoint we are discussing in details, that will be dealing with if the child teases and makes fun of other children. So when this kind of situation happens, what is that we are going to do, how we can manage, and as preschool stakeholders, what are the few things we need to do to modify the child's behavior. That's what we are going to discuss in our next session. Until then, thank you so much for your patient listening, and we are sure this very basic awareness and basic information is going to help you in a long way to contribute each and every child's growth to make them a fantastic human being in future. So thank you very much, and looking forward to talk to you in our next session.